Hi guys, this is Dr. T and welcome to Clinical Medicine with Dr. T. In this tutorial, I want us to talk about long bone fractures. Long bone fractures. Okay, maybe right there. Long bone fractures. So, when we talk about long bones, we are referring to the following bones: the femur, the tibia, the fibula, the ulna, the radius. So these are long bones. Long bones, these are very strong bones, ne? They are very strong bones. Number one. And the reason why they are very strong is because they are compact bones. So they are stronger bones compared to the spongy bones, which are most of the times flat bones. So these bones, for them to fracture, they need excessive force. Excessive force or some kind of bone pathology. They don't just fracture. These let's talk about young people. When a young person fractures a long bone, it means that excessive energy or high energy was involved. High energy was involved. And situations whereby we get high energy being involved is things like motor vehicle accident, PVAs, pedestrian vehicle accident, fall from height, gunshot, assault as well. We get especially mob justice, specifically mob justice or mob injustice, whatever you want to call it. So assault is not a high energy, but I want to put it here because of mob justice, because we are being assaulted by so many people when you're talking about a mob justice. It's a mob. So if a young person fractures a long bone, it's because of those reasons. Most of the times they don't just fracture long bones. But when you talk about the elderly, it's a different scenario. Yes, an elderly person can get a long bone fracture because as a result of these, but with them it's more common with osteoporosis because of the age, because of menopause, because of some kind of medication, because they usually have comorbidities. They might be getting medication that is making their bones to be weak. And I'm gonna put malignancy here. as in cancer of the bones. Someone young can have a cancer in the bone and then they fracture their long bone. Even the elderly can have a cancer in their bone and then they fracture. So this one counts for both, right? The elderly, one of the reasons why an elderly person can walk, especially with them, the most common, they can just be walking and then they trip over something very small and then they fracture. This is where you get your neck of femur fractures. Neck of femur fractures do not need an elderly person to have maybe fallen from a height or excessive force. They can just fracture by just walking or by just tripping on something very, very small that a person who's younger would trip and not a fracture. Okay, so the reason why it's important to understand the mechanism or the type of energy that was involved when a patient who comes in with a fracture is because when we say it's high energy that is involved there, so which means because it's high energy, it's likely that there are other injuries as well. Like for instance, if a person falls from a height and they fracture their femur, the fact that they fell from a height, it means they might as well be having other injuries: C-spine injuries, lumbar injuries, T-spine injuries, rib fractures, abdominal injuries, what is this? Bladder injuries, and all of that. So the fact that there was high energy involved, falls, PVA, MVA, look out for other injuries. So if you happen to find a femur fracture, don't only look at the femur fracture, look at other injuries because they fell, because it was an MVA, because it was a PVA. Some people would say a fall, a PVA, and MVA, treat that patient as a polytrauma patient. Which means now you're gonna do those X-rays, your C-spine, T-spine, even though they did not complain about any of those: C-spine, T-spine, L-spine, pelvic X-ray, lower limb X-rays, and just make sure that you're not missing anything out. Especially if someone comes in, they are unconscious. After resuscitating them, you wanna know, because they won't tell you, if I also have a pain here. You will only focus on the fracture that is obvious and miss the others. So it needs us as doctors to be very critical when we are dealing with this kind of patients, to make sure that we don't miss out anything. Yeah, so this is just a background. What I wanted to talk about in this video is how to describe long bone fractures. Description of long bone fractures. What is important is, it's very important to know how to describe fractures so that your notes become clear, so that even the next person who reads your notes can see what fracture you described. And also, if it's also important when you want to discuss with a senior or to discuss with an orthopod in another hospital, so it becomes easy when you guys are on the same page in terms of describing the fracture. So what is important is, with long bone fractures, the first important thing is, which limb is it? Is it the left upper limb? Is it the right upper limb? Is it so basically, which bone is it? Is it the right femur? Is it the left femur? Is it the right radius, left radius, things like that? And secondly, the location of the fracture. And to make it easy to describe the location, it's important to divide your long bone into thirds. Let's say if this is my femur, if this is my femur, I'll divide it like that. This is the proximal third, this is the middle third, this is the distal third. Proximal third, middle third, distal third. So if I've got a fracture here, I'll describe the fracture which we're going to talk about now. I'll describe the type of a fracture, and then I'll say it's in the distal third of the right femur. It's in the middle third of the right femur. It's in the proximal third of the right femur. So it's important to divide your long bones into thirds. So remember the thirds. The next thing that becomes important is to describe the pattern of the fracture. We're going to talk about that now. The last thing that I normally do is to talk about displacement. When I describe my fracture. So when we have a fracture, let's say we have a fracture like this. Let's say this is our bone, whatever bone it is. If we have a fracture that extends from one cortex to the other and meets the other at right angles, or they are at meets the other at right angles like that, that's a transverse fracture. It's a transverse fracture. If I have a fracture that extends like this, this is an oblique fracture. Oblique fracture. If I have a fracture that extends like this, something like that, or let me do this. It's a spiral fracture. If I've got a fracture that is like this, that's a segmented fracture. And these terms, you are gonna have to use them when you discuss a patient, when you present a patient. You are gonna have to use them. They are standard terms. If I have a fracture, sometimes you can have a combination of this and this. They call it a spiral oblique. Goes like this. I cannot draw it now, but So remember, there's also what they call a spiral oblique. It's a combination of an oblique fracture and a spiral fracture. They call it a spiral oblique. When you see it, you will know about it. You just know that's a spiral oblique fracture. But I can't draw it here. I'm not good with drawing. Or maybe if you've got a fracture like this, they call this the butterfly. The butterfly fracture. Or you can have a fracture that is like this. I want to make this like I'm struggling to draw this fracture, but it's called a hairline fracture. A hairline. It's so thin, like it's like hair, like a hair filament. It's so thin. It's so thin. Unlike these ones that you can just see, okay, there's a fracture there, 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 there's a fracture there. That one is like so thin, like or you can have a fracture that has got that looks like this. That's a comminuted fracture. Comminuted fracture. These are the most common fractures, guys. So when it comes to fractures, the extremes are like your hairline, minimal fracture, and comminuted. Those are like two extremes. We can also have a fracture whereby you have something like this. Say this is a bone, and then you've got something like this, and then you have something like this. It's so hard to draw this kind of a fracture. This part maybe is just like open, and then there's a fracture. The fracture is like this. Then this cortex is still intact, but then there's a fracture that side. That would be a green stick fracture, which is a pediatric green stick. Sometimes a green stick you would have a fracture like that. You would have a fracture that is here, but the two cortex are still intact, or they are minimally damaged. That's still a green stick fracture. So a green stick fracture is a pediatric kind of a fracture. The cortex is so strong that it keeps the so the bones of the kiddies, they are a bit flexible compared to ours. It's also not easy to break a bone that is so flexible. So they normally don't get a complete depending on the age. They normally don't get a complete fracture easily. So they just get a green stick whereby you can see the swelling of the hand, and then there's maybe some the periosteum looks a bit swollen, but it's not a complete fracture. But you can maybe see even a hairline sometimes. So those are called green stick fractures. So I think these are the most common fractures that we meet: transverse fracture, oblique fracture, spiral fracture, segmented. So you've got two parts: green stick fracture, butterfly, comminuted fracture or spiral oblique, most common. If there's a fracture pattern that I'm forgetting, I'm just gonna put it as a comment. So a hairline fracture as well, right? So these fractures, one thing that we need also to remember, these fractures can come in as either, maybe I should talk about this in another video, open or closed, but we're going to talk about it in another video. Let's make this to be part 1. Thanks guys for watching.